loss alopecia can affect just your scalp or your entire body, and it can be temporary or permanent. It can be the result of heredity, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it's more common in men. The most common cause of hair loss is a hereditary condition that happens with aging. This condition is called androgenic alopecia, male pattern baldness, and female pattern baldness. A variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Medical conditions include alopecia areata, which is immune system related and causes patchy hair loss. Scalp infections such as ringworm. Hair loss can be a side effect of certain drugs, such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. The hair may not grow back the same as it was before. Many people experience a general thinning of hair several months after a physical or emotional shock. This type of hair loss is temporary. Excessive hairstyling or hairstyles that pull your hair tight, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. Hot oil hair treatments and permanents also can cause hair to fall out. If scarring occurs, hair loss could be permanent.